Right about now, joining us to talk more regarding government's advocacy campaign on cholera and, of course, COVID-19 is the Commissioner for Health, Cross River State, Dr. Betta Edu. Good to have you on the program.
Thank you for having me. Good afternoon.
All right, now the outbreak of cholera is one that's taken the country by storm, as it were. What's the situation in Cross River State in terms of rate of infection, and how is the state government's enlightenment campaign taking shape, especially the border communities?
So we have very low rate of infection in Cross River State, and the persons who are close to the Cameroon borders are mostly affected. We have areas in Cross River State, especially in the creeks, where we have cases emanating from those areas. Presently, we've had about 9 cases test positive on RDT and 4 have tested positive on further investigations. We have lost 2 persons to cholera already, and we're doing our best to see how we can sensitize the community, work on the cleanliness and sanitation in those communities, the water source, and of course, try to encourage them to end open defecation, which is one of the huge problems that we're facing. A lot of partnership with WHO and indeed UNICEF is very, very useful. NCDC has given their support from the national. We are out on the field sensitizing people, training health workers, building their capacity to be able to manage cases. We're taking samples from homes, from people who have signs of diarrhea, and indeed going around to ensure that these people understand what they should be doing to prevent cholera.
All right, so what other initiatives are you coming up with in the health ministry, apart from this campaign, of course, to keep residents aware from cholera, and safe, especially children and the elderly? Of course, we also have other diseases, COVID-19, malaria, diabetes, from the reports which I'm sure you just saw.
Yes, so we are actually identifying the source of infection, and we're also working on early detection of this disease. We're also ensuring that those sources are chlorinated so that we can reduce the spread of the infection. People have been advised, whether it is water that you're using to wash your mouth or you're using to cook, or is even your food or management of your food items and drinking water, including washing your hands often. These are all interventions that are ongoing, information that are being disseminated. We have provided points in parks for them to have latrines. So we've been able to build at least 4 latrines within the last 2 weeks in Bakassi, in their public park, and of course by the port side, by the river side, where people come in from southern Cameroon. We've heard that there's an outbreak in southern Cameroon. We're also having issues around some of the creeks where we have security challenges. But however, we are intervening in those places, and it's a holistic response, both by Cross River State government, supported by our partners.
All right, now, Honorable Commissioner, of course, we know we're still in the pandemic, talking about COVID-19. In terms of vaccination, how is the exercise being handled as it affects a number of people, getting the jabs? And then we talk about the issue of vaccine racketeering in the state. How is the state government looking into that? Are we even seeing improvements in compliance levels as far as protocols are concerned?
So for compliance to protocols, we're a bit worried because more and more people are believing that the COVID-19 pandemic is over, and so they can go ahead and do just whatsoever they want. But at this time, we have just launched some 2 hours ago the massive vaccination for Cross River State. We have about 36,000 doses, which we must exhaust within the next 1 week. Remember, there is a new variant, which is the super variant that has just been identified in South Africa and in other parts of the southern coast. And this is really a concern for us, except we get people vaccinated massively, both formal official workers in their workplace and, of course, the informal persons, private sectors, businessmen and women, churches, traditional rulers to get involved so that we can utilize these 36,000 doses that we have and order for more. Then we would be really in a bad situation. We are encouraging Cross Riverians massively to come out this week and get vaccinated. We have just 6 days to exhaust 36,000, even though we have some level of hesitancy, but we have been working with different bodies to ensure that we overcome this and get more persons vaccinated within a very short time.
All right, Commissioner for Health, Cross River State, Dr. Betta Edu, we thank you so much for your thoughts on News Across Nigeria.
Thank you for having me.
We're in Lagos now.